this meeting to order. Please turn on your microphone when speaking and mute when not speaking. The MAG public comment process allows member of the public to comment on items on today's agenda or on items that fall under the COC's jurisdiction. If you would like to comment at today's meeting, please fill out a white request to speak card by the door and give it to MAG staff. If you parked in the garage, parking validators are available by the door. If you purchased a transit ticket to come to the meeting, please see staff for reimbursement ticket. Oops, hold on, sorry. We've got a board member on their way. One more is coming. So Brian, if you could please take roll call and then we'll grab that other board member when they arrive.
Danielle Wright.
Arizona Coalition and Central Domestic Violence.
Letitia Brown Gambino. Tim Birch. Liz DaCosta.
Hello, Liz DaCosta with Access here.
Michael Hughes.
Here, a new lead.
Jessica Raymond. Charles Sullivan.
Here from ABC Housing.
Sienna Valdez. Cricket Weatherington.
Here.
Co-chair Rachel Milne.
Here, City of Phoenix.
Nathan Smith.
Here.
Chris Hallett.
Here, City of Peoria.
Caitlin Dean.
Here, Maricopa County.
Gabriel Jaramillo. Emma Garcia.
Here, Valley Sun United Way.
Matthew Kelly.
Matthew Kelly, Mercy Care.
Co-chair Vicky Phillips. That's it.
All right, so we have a quorum. Oh, and Tim just joined online. Hi, Tim.
Hi, Tim Burt, City of Tempe, remote. Thank you for the accommodation.
All right, item number 2 is the call to the audience. This is the opportunity for the public to comment on items that fall under the Continuum of Care board that are not on the agenda or that are on the agenda for discussion and not for action. 15 minutes will be provided for the call to the audience unless the committee requests an exception to that limit. Brian, were there any comments today?
There were no comments today.
Okay, you. All right, item number 3 is our informational items. So 3A and 3B are for information only. And lots of information was provided in the packet. Does any member of the board have any questions or requests for a presentation on the information items? All right, hearing nothing, we'll move on to the consent agenda. Item number 4 is the consent agenda. 4A through 4C are on the agenda for consent. Does any board member have any questions, comments, or request a presentation on any of the consent items? Does any member of the public wish to comment on any of the consent items? Seeing none, can I have a motion to approve the consent items?
Move for approval.
Thank you. And is there a second?
Second.
Thank you, Matthew. Any discussion on the motion from the board or comments from the public? All right. So for those in the room, we're going to take a voice vote, and I guess for Tim too, right? No.
Yes, for Tim as well.
Okay. All those in favor, please say aye.
Aye.
Any opposed, please say nay. Motion passes. All right, item number 5. So we're back to getting a collaborative update at every one of our board meetings. And the first one we're going to hear from is the Coordinated Entry Collaborative. So happy to have Matthew Kelly here to give us an update on what the Coordinated Entry Collaborative has been working on.
Okay, thank you. Just a little typo. It's April 28th, not April 10th, but I just noticed that right now. Oops, I think we shifted. Oh, thank you. All right. All right. Cool. If we could just go to the next slide. I'm not sure who's managing. we're going to cover just a couple of things, progress on our strategic plan goals, as well as a map tool update, which is directly related to most of our strategic plan work. So, oh,
Ooh, check that out.
fancy. All right, so here's just the quick high level of our goals. We're going to go through each one of these individually. Just more or less, we have two of our goals that are primarily complete, and we are working on the third goal. A lot of work left to do on some of that third goal, but we are nearing, I think, the end zone on a lot of the work. So I'm super excited to report out on it. Goal 1 is to integrate domestic violence data within the homeless response system. This has been something I think we've been working on now for almost 24 months. We've had a work group that's been established, meeting on a monthly basis. I just want to acknowledge the amount of time and effort that people have put into this. So thank you for that. We've been able to establish a CE/DV pathway. It's not complete full integration. However, we do have a way for the CE and DV systems to coordinate and communicate and make sure that there's access to resources for individuals in the domestic violence system. We've engaged the 9 victim service providers. We've increased the CE assessment capacity for those providers, as well as we've done some enhanced training for victim service provider leadership and assessors. And then we are continuing to meet monthly to monitor performance management. Thanks to Solari, they pulled some regular reporting together for that. So we're able to get some real line sight into what's happening within that system. I also want to, just in addition to that from this group, while I think a lot of what we've done within coordinated entry is really kind of, I think, come to fruition as far as I think that work is considered, that DV work group is still looking at how they could be contributing and participating in the broader system. So I think a lot of the work they're now doing is trying to define what their path is going to be moving forward and trying to look at other areas, not only from some of the statewide work that's being done, as well as some other areas of opportunities within our overall system. So I just want to say thanks to that group for, I think, taking the charge and then continuing the path forward. And also to Natalie for facilitating that meeting on a monthly basis and keeping that on track. So thank you. Next up, goal 2, evaluate access to the system across demographics to determine discrepancies and recommend policy changes. We have responded to most of the equity-related findings from the home-based coordinated entry evaluation. I will talk a little bit more about this. I think this is super high level, but a lot of the work that we've been doing, I think, kind of all coincides under goal 3, where we're looking at this even more. Goal 3, increase access within the coordinated entry system. We've designed and piloted the map tool that's currently in pilot phase, trained all the coordinated entry staff on the new tool. We've analyzed the pilot data for redundancy and equity. We've had a number of meetings, not only internally, but also with the university collaborative. I don't want to say, I forget what their full thing is, but to evaluate that data. I just don't want to say ASHAC, that's fine. We've conducted focus groups. Those focus groups were really focused on people who are offering the assessment, as well as individuals receiving the assessment, to get some feedback, not only on the questions, but also just from the assessors who are actually doing that. We held a prioritization forum. We had representation, I think, across over 20 different providers, and I think we had about 40 people who were present in that prioritization forum to help us decide what the path for prioritization is looking like for the new map tool moving forward. And the last thing we're going to be doing is finalizing the prioritization and rollout on June 30th. That is our goal, and I believe that's actually what we're on track for right now. So we'll give a little bit more of a detailed here as we go on. Increase access within the coordinated entry system, increase percentage of assessed households on the BNL or the by name list. We have developed some LMS trainings and online resources for providers in the system. And then the last one, collaborate with CE leads to evaluate entry points for efficacy and assessment rate. I can report is a slight update to this. I know that the single adult coordinated entry has done some training across their continuum, and actually they've already seen a slight increase in the number of individuals who are being assessed. I think they said it was a 12% increase from when they started trainings from when before, but we are starting to see some of that. And I anticipate with the new map tool being a little bit more simplified, we might actually see that increase pretty significantly. All right. Increase access within the coordinated entry system, expand culturally specific outreach to Black, Native, and Latino individuals, engage community centers, cultural hubs, and service providers to reach underserved populations, improve the LMS training for assessors, and create a tool to identify geographic areas of need within the coordinated entry system. I think it's important to note here that with regards to this, there's a lot of work that's been happening in the background. So we actually have a mapping tool that's in development. And that mapping tool is basically going to be overlaying point-in-time data, the coordinated entry access points, as well as data from outreach providers in our system, more or less trying to map where people are at, where services are being provided, where outreach is being done in our system to determine if there are gaps for access points within our overall system, whether that be outreach or physical access points. So this is something that's in process, but we are patiently waiting on the data team at MEG for some additional information to really be able to make some recommendations. This was pretty much, and I think it's important to also know that the coordinated entry evaluation did talk about the need for more access points across the system. But what's really, I think, important to note is that evaluation did not tell us any data about why we need more access points. So we're really trying to find a way to evaluate that on a consistent and ongoing basis. This is kind of our solution. Once this tool is in place, we should be able to look at this mapping tool on an annual basis and say, this is what we know, and this is where we see the need for access points across our system. So I'm super excited about this portion of it. It's not super fun per se, but I think it's an improvement across the system and really being able to show where the need exists in our system rather than just discuss it. Provide continuous improvement and oversight of coordinated entry. We have identified the coordinated entry key performance indicators. We are still working on developing benchmarks for assessment rates and system flow and referral success. And then I think last and not least, there have been some initial discussions on planning and conducting an annual CE evaluation due to the fact that the map tool is kind of in full swing right now and we're working towards implementation. We have put that on hold. We are going to be taking this back up in July, I believe, once that tool is in implementation.
Matthew, can I ask you a question?
Of course.
Just on the increased access, do you have like by how much? In other words, like by a lot, by a little, but I mean, what?
Say more. I'm sorry. What do you mean?
Say increased access within coordinated entry.
I think we're trying to determine what the access need is. I think
Okay.
there has been, the coordinated entry evaluation said that we needed to increase access. And I think the real question is, do we actually have enough access points in our system? Or we need to be able to know what that is from a more factual basis rather than what amounted to the focus groups that were saying that as much. There wasn't really a whole lot of data to support that. Yeah.
Hey, Matt, and also on that, are you talking singles or family coordinated entry access points?
Yes.
Yeah.
Both. Yeah. It's in both cases we're mapping for sure. Are there any more questions? Cool. Am I going backwards? Yep, I am. Okay, here we go. Maricopa assessment and prioritization tool. I'm super excited about this. This is the timeline. This shows how long our community has been working on this. We had a coordinated entry evaluation that was done in 2022-23. In April of 2023, we had the development of the map tool. That was a every other week work group that met for about 6 months to kind of develop that map tool. In January of 2024, the map tool pilot began. Basically, we're doing VI SPDATs in tandem with the new map tool. In April 2024, the HUD assessment work group was done. So we had basically the coordinated entry leads, the coordinated entry co-chairs, as well as some MAG staff who participated in this assessment work group, just trying to see if there were other opportunities for us to improve our assessment as we were moving forward. Starting in October 2024, probably a little bit before that, but we engaged HAZHAC for analysis of our data. We were looking at a number of different data points to ensure that the assessment was actually providing equitable results as it relates to our population. I can say that there was some minor adjustments that were made, but all in all, I think I'm happy to report that the data actually supported the work we were doing. In November 2024, ASU did some focus groups. Those focus groups were focused on individuals who were actually taking and participating in the assessment primarily, and that was really kind of making sure that they understood the questions. And we also kind of did some evaluation on the overall language of the questions, and I believe we made some adjustments and improvements to bring the grade level language, or the grade level of the questions down to a lower level so that they were more easily understood across the community. In February 2025, we held the CE prioritization forum, kind of referenced that in our last thing. So that happened. And then we're looking at June 30th of 2025 for the tool transition. That means that we would be phasing out the VI spit out altogether and rolling into the map tool. So this is just kind of a nice little picture. We had some inequity in scoring in the VI spit out, as we all know. Re-traumatization from the number of questions that were being asked, and then also predetermined buckets per se. So whether you were rapid, whether you were PRSH, you were kind of predetermined into one of those two buckets. With the map tool, we're hoping to, and we have shown just based upon our pilot, that we are reducing inequity across the system. With regards to re-traumatization, we are only asking 4 questions right now of individuals. The remainder of the data is pulled from data points across the system, whether it's HMIS data and or, why did I just forget it? Profile data. Yeah. Anyways, and then of course, sorry, I had a moment. And then data-informed prioritization. So really trying to look at that data. I think one of the things we're kind of looking to do is like not only just create a bucketed score for our tool. Now we're actually looking at some of the data and the responses to determine whether or not, you know, what intervention makes the most sense for the individual based upon some of this data. So for some of you who are not here, we're happy to share some of the further details on this, but we can do this. But there are a number of factors that go into determining the map tool. The first one is chronicity of the individual, health history, high system utilization. And so for this next one is for families specifically. I'm sorry, I apologize, my bad. This is for everybody: foster care or Department of Child Safety involvement, justice system involvement, and then last but not least, family composition. That's specifically for the families in effort to provide some more insight into those families and their needs. Here's where we're at right now. We have a couple of things that we are going to be continuing to work on. We're going to be finalizing the prioritization process. Our prioritization forum gave us a lot of insight from the community as what they wanted to see as far as the new prioritization tool. We did have a data request that was part of the consent agenda today that's actually going to be pulling individual data for individuals who have been housed that we do have VI and MAP data for over the last year and 4 months. We're going to be analyzing that data to make some final recommendations for prioritization. We anticipate bringing that to you all next month. That's obviously the next one, which is present to the board for final approval. So we're going to be presenting the tool and the prioritization schema and hopefully looking for a approval for us to be able to proceed on June 30th. And then finally retire the VI SPDAT. And then last and definitely not least, designing ongoing evaluation and improvement plan for the new map tool. I think a lot of times we were looking with the VI SPDAT and not really evaluating any of the data or the outcomes. We want to intentionally make sure that we're not doing that and put into place some of these improvement plans from the get-go so that we know how to evaluate it and we have it on a set schedule. I'm open to questions on this before I move forward. Lots to take in.
Hi, Matt. This is Tish.
Hey, Tish.
Hi. The last point of designing ongoing evaluation and improvement plans, do you all have any thoughts on that? Is it going to be a continuation of what you've already been doing with the map tool?
I think it's going to be more than that because I think we're actually going to have actual referrals and actual outcomes to evaluate. So I think it's going to be a little bit more than just what we've been looking at because we've been kind of looking at predictive data at this point, not necessarily individuals who have been successfully referred using the new tool, if that makes sense.
And did you see any significant differences between the single CE and the family CE in regards to the map tool?
There was some-
Anything that, okay.
Yeah. So there was some minor differences. There was more discrepancy or inequity reported within the family side of the evaluation when we had ASAC look at it. In response to that, we actually made some minor adjustments to the the map tool to accommodate for that. And that adjustment has shown to be that we're kind of now hand in hand as far as families.
Mhm. And what was that adjustment? Just curious.
I'm so sorry. I really don't have that. I'm happy to meet you.
Okay,
Discuss that. That kind of gets into some of the details and I don't necessarily want to miss.
okay, I'll follow up with you offline. Thank you.
Thank you. I'm so sorry.
How long was this SPDAT tool in use?
Isn't since the inception of coordinated entry? So that's 2015?
Okay.
Yeah. Yeah.
12 and 13, because I know where I was working then. And they
Was it
started
earlier?
working.
Okay. Yeah. Thank you. Any other questions? I mean, I think for me, like I'm here today because we're kind of telling the board, hey, we're getting close to the end of the road here. And we want to make sure that if there isn't feedback from you all that we could receive, things that we should be taking into account that we aren't already taking into account. I really would like that feedback today. I have to be super honest. I'm like taskmaster sometimes with regards to the the timing of all of this, and I really want to see this on June 30th. So if there's any feedback that we can start to incorporate, I'd love to take that from you all back to the coordinated entry collaborative so we could incorporate that in this process.
I have two things.
Yeah.
The first thing is I really do want to thank all the coordinated entry committee, collaborative folks and Natalie, and especially the co-chairs, and I'll talk about Matt specifically, although he's not currently a co-chair, that they have been meeting twice a month for, it seems like forever, getting this done. So that's his comment. My question, or I don't know, request is that when we come back with the additional information that we talk about what our plan is to deal with the folks that are already assessed with the VI. Like what's the plan for those folks? And that we come back with a little bit more, if we have it, when we have it, what the actual rollout is so that people are aware and have time to weigh in on that. Thank you.
And I assume you're referring to individuals who've been assessed
With the
only
VI.
a VI and
Correct.
not the map.
Yes.
Okay. Was there another thing you had?
No, do you know that you probably, what percentage or how are we rolling with that right now? How many? We're doing both for a percentage of people. Is it most of them? Is it half of them? Do we have any idea?
I don't have that.
Okay.
Natalie, if you're here and you have that information, I'd be happy to hear that from you. I mean, you gotta love her.
So last we checked, it was around 42% of the by name list has been assessed with MAP, which is comparable with the VI SPDAT. So when we bring back this presentation in May, we'll be bringing you an exact number of our gap. But in reality, MAP has been on the ground and running since January of 2024. So the majority of, there are very few people who do not have a full complete MAP score.
Thank you.
Hey, Natalie, sorry, real quick, before you go, just to kind of frame this, map is out there, it exists. When we talk about rollout, it's more like pulling back VI, right?
Correct. It's think about more like VI retirement. MAP has been out in the field. All of our assessors are trained. We've had thousands and thousands of people complete the MAP assessment questions. So we're already at, it's really our decision to step back from the VI SPDAT.
Liz, did you have a question too?
No, incredible work. I've watched from afar a little bit, from the beginning till now. So I was just mentioning before, to see it now come through in this data share request that we approved on the consent agenda is just fantastic job. You've like completely followed it through to the end. I do look forward to seeing the results from what Richard's able to review in the analytics. So to make further decisions, but thank you so much, Matt.
Yeah, Richard's not here, but Richard should also get a lot of credit. He forces us to consider things that we wouldn't always consider from like the PhD level of things. And I appreciate, as much as he frustrates me, I appreciate everything he says, because I think it forces this tool to be a little bit better every time we have these conversations. So
I second that. It is really hard when the minute he opens his mouth and everyone groans and like puts their head down. But then he's always right. So I think it's been a long thing, but it's good work.
yeah.
Question for you. And second, everything except for Richard, who works for CAST, does not frustrate me, but I could see where it creates a lot of extra work, and it's always good work. So shout out to Richard too. I'm just, what are the KPIs? You said that there are some indicators that you'll use to measure how well it's performing and whatnot. What are those?
That I don't necessarily know. I'm assuming that we're going to be looking at success in housing and the success of that intervention. So I think it's going to be some time before we're going to be able to but it's going to take a little bit of time for us to do that. That's, I think, that understanding about evaluating the assessment, I think, is where we're going to get into some of those details and evaluating that portion.
So I know they haven't been measured, but they haven't even been quite determined just yet.
Correct.
Got it. Okay.
I'm open to plenty of feedback on that, and I think there's a lot of opportunity there. So,
Matt, I do want to thank you and Richard for working very diligently with the CE leads. That was phenomenal. So thank you. And thank you for listening to us and involving us in the process.
coordinated entry between its work groups and the meetings and the planning meets anywhere from 6 to 8 times a month. And I just want to say I appreciate everybody's efforts and putting the time into doing all this work, whether it's a prioritization conversation about a work group, whether it's the DV or it's the regular meetings where all of these things are being discussed. It requires that level of participation, and that's been happening now for 3+ years. So, and I just want to acknowledge that that's a lot of work for what is ultimately a volunteer process. So I think I appreciate it, and we couldn't necessarily do this work without some of that. So.
Great. Thank you so much for this very comprehensive overview. I think we're going to be ready next month for the big vote. So this was a nice prep for all of that. So
and if there's something after the meeting you all think of, we're super interested in hearing your feedback because we want to be able to incorporate it. So please feel free to reach out to me. I really would love that opportunity. We've got a couple of meetings already on the books for this discussion to kind of work to finalize things. So if there are additional things we can take into account, we have time. June 30th is our anticipated rollout. We're hoping to get an approval next month. So we've got some space here to do this. So just please let us know. Thank you.
Thank you. All right, moving on to the next agenda item. It's our crisis communications plan, agenda item number 6. The communications work group has developed a crisis communications plan to guide the COC response during disruptions. MAG staff will present this plan and then we'll be requesting approval from the board. So this item is on the agenda for approval today.
Hello, thank you, COC board. So I'm here today to talk about a proposed crisis communications policy that was developed by members of the communications work group. So before I kind of get into exactly what the policy looks like, I wanted to talk through what brought us to this moment, to this idea, and also highlight while this policy is digital and is available in the online packet. If anybody doesn't have the online packet with them, they can scan the QR code up there as well. It'll show up on their phone. But to start, this kind of all came out of, yeah, I'm sure everybody remembers that on January 27th of 2025, the U.S. Office of Management and Budget put a temporary pause on the disbursement of federal grant funds. That, of course, was very stressful. And the COC board, you all, and MAG staff really jumped in to push out communications, push out that leadership for the region, and help put all of those anxieties to ease a little bit for our service providers in our community. So while that pause was temporary, it really did present an opportunity that the COC can build up what its crisis communications looks like and policies around that. So this is where that comes out of. We had 4 folks from the crisis comms, or excuse me, from the communications work group be on this project team. So Sagra Osman, who's with CAS, John Ellinger with the Garcia Family Foundation, Haley Owens with the City of Phoenix, and Jim McPherson with the Phoenix Community Alliance. This really is broken down into 2 different components, and the one that we're going to be focusing on today is the policy itself. So the policy is what you all will be approving or denying, and making sure that it really kind of steps out what the broad steps are that the COC should be taking. And then the action guide is something separate, it's supplementary, and is really focused on a kind of step-by-step task list for this rolling out crisis communications. So today we'll really be honing in on the policy itself. There are 3 elements to this policy: the crisis identification and activation framework, the crisis management team, and the crisis response protocols. So we'll be looking at a very high level of each of these sections. Starting first with the crisis identification and activation framework. It's really important to even figure out how to define a crisis. There's, of course, many different types of crises. And so the communications work group understood it's going to be a little bit impossible to try to define and name every single type of crisis that could potentially happen. So they attempted to develop a framework that could be applied as a sort of umbrella, and then identify what specific type of crisis it is moving on from that framework. So some of those different types of crises could include a funding and policy crisis, service provision failures, governance and administrative breakdowns, public safety, reputation, and societal crises. So of course, a whole broad swath, and what that looks like in the guide for each of those would be a little bit different, but the intention is to make sure that there is the framework and setting for the COC at large to be able to act. So as a part of this identification process, there are a couple questions that would be asked to assess if it is a crisis. 1, does the incident touch multiple programs, partners, program participants, or geographic areas? Is the situation moving faster than routine governance allows? Could shelter, food, health, HMIS, or coordinated entry be disrupted without rapid action? And would the COC's ability to coordinate system-wide responses be impaired? Are rules, dollars, or contracts already changing in a way that blocks operations? And is there a clear, credible concern from providers, clients, officials, or media? So a couple steps to actually activate and determine if something is a crisis. So 1 is go through those questions, kind of assess the situation, and use that as a sort of checklist. That would be on collaborative applicant staff, on MAG staff, to monitor if there was something that seemed like a crisis. They would complete that checklist and come to the COC board leadership, the co-chairs, and discuss with them, show them this checklist, show them the evidence that is supporting their determination, and receive feedback from the board chairs on whether or not it would be appropriate to convene a crisis management team. If yes, then the crisis management team would be convened within 24 hours. And the crisis management team would be presented that same exact, that same exact checklist and go through the process to determine, they all would vote and determine if it was a crisis. And if so, then be able to follow through with a crisis communications plan. Or if it wasn't, it would go back to MAG staff to essentially monitor the situation, see if anything else changes or arises from there. One thing I wanted to highlight as well is there essentially by the co-chairs convening the crisis management team and the crisis management team being able to vote, there would be a decision-making and authority shift for this crisis. So the focus would be allowing you all as the board would allow the crisis management team to act as one voice of the COC during the crisis. This policy very clearly outlines that a crisis would not last. This crisis management team and that authority would not last longer than 2 weeks. The intention is when things are moving fast and moving quickly, it's tough to get the whole board and get quorum, get everybody in the same room. And so with 2 weeks, that would allow for the traditional governance operations to be put back into motion, but to kind of allow this crisis management team to act as one voice in that stopgap. So moving on from there, the crisis management team or CMT would have standing membership. There would be at least one individual with each one of these seats outlined here. And really their purpose is to guide the communications for this crisis. They would coordinate messaging. They could make rapid decisions around either guidance to the community or communications at large. And something of note is that this standing committee the intention is that this is a 1-year term. Somebody that would be volunteering and signing up for this would say, yes, I'm ready to participate in this for 1 year and understand that if a crisis occurs, I'd be called and would be ready to jump on a call at that moment. Or, where appropriate. We know that is kind of a really loose and broad thing, but we want to highlight too that if there is a crisis, every single one of these seats, whoever is holding these positions, would need to be able to communicate to their own organizations, their own jurisdictions as well. And so hopefully this kind of lightens the load for everybody. So with that, there are kind of a couple different procedures that would go through with this. One, I highlight as situational invitees. So this is, well, you see those 6 members of the crisis management team are standing members. Each crisis is different, and it would be important and imperative for the crisis management team to identify what subject matter experts, jurisdictional representatives, service provider representatives should they be bringing into this conversation and asking to sit at this table and make these communication decisions with them. Then moving on to quorum and voting, wanted to highlight that quorum would be just a simple majority of that core membership, those 6 individuals who have voting seats, and decisions would be made by a simple majority of those voting. Then training and orientation. Because this isn't something that hopefully is happening frequently, it'd be important that whoever is on this committee is familiar and ready, or excuse me, whoever's on this crisis management team is familiar with what this process looks like and what the action guide looks like. So once a year, there would be just an afternoon session of bringing together the crisis management team, making sure that everybody's familiar with each other and who's in the room, and that they're familiar with this policy and the subsequent action guide. There would be a live roster record. This would be maintained in the action guide by collaborative applicant staff, by MAG staff. Then something important would be assigning these operational roles. So every single crisis requires different roles and duties and responsibilities. And it would be on, as a part of this policy, the crisis management team would determine in that first meeting, what are the roles that are pertinent for the crisis at hand. There is a long list of potential operational roles within the policy so that they can pull on those and don't need to spend a lot of cognitive load thinking about that. And then the final is around stakeholder communication. So within the policy, the work group identified segments, stakeholder segments, who would fall within that segment and what communication channels that segment would kind of receive from. So you'll see in there, there is a long list, but it identifies primary channels. So that's kind of where it's easiest to push out information right away. And then secondary channels where that is where there can be more in-depth information. That can be things that are live briefings to bring everybody in the room or online. And then a tertiary or a backup channel for if, again, who knows what type of crisis. So if all things kind of fall apart for our traditional infrastructure, then we can lean on that. Yes.
So are you saying the quorum is 6 voting members?
Yes, as of how it's
Okay.
currently written.
So would it be 6? Would it be the quorum be, you have to have at least 4, or would it be a quorum of those present?
A quorum would be 4 of the members and 4 of these core seats being in that room and being present for the meeting, or virtual room, if you will. And then the final piece of this is just these crisis response protocols. So these are outlined real broadly in the policy. Again, this would really get into nitty-gritty details in this action guide that would supplement this, and that action guide being those step-by-step tasks and instructions. But you can see here 3 broad phases. This first hour response, what is everything that MAG staff, the COC board and co-chairs, and the crisis management team, what is everything that should be happening in that first hour that a crisis is identified? Then that ongoing response and coordination. So that would be in the 2 weeks following, there'd be an expectation for the crisis management team to meet daily to respond to a crisis that is unfolding. And the 2 weeks is, again, that maximum is that cap. If the CMT determines they were like, okay, that was a really hectic 5 days, and now we're at the end of that crisis, they can vote to end it there and then enter into this 3rd phase of recovery and after action. And finally, just wanted to highlight these 5 directives. So that is, this policy directs to use the action guide as that step-by-step process. There will be templates included in that action guide. And really the focus is to try to make crisis communication as simple as possible. Then documentation, all major decisions and external messages would need to be logged in a communications log. There would be this authority shift, as I've outlined. The other big directive is identifying and really putting barriers on the role within the COC. So the crisis management team's authority would be limited to communication and coordinating, or rather providing guidance and technical assistance to the community, and then advocacy for external policies that would directly mitigate the crisis. The CMT would not have authority to create or modify COC policy, governance, or operations. And then finally, that this would be reviewed annually, especially if there was a crisis, it would be important to look back at this and say, was this actually helpful? So with that, I'm ready for any questions. I also have a QR code up there to meet with me for a 30-minute meeting if you wanted to kind of dig into it more, because I know we have a limited amount of time in today's meeting.
Thank you, Matt. Any board questions for Matt on the crisis communications plan? No questions? Someone want to jump in for a motion to approve Matt's crisis communications plan?
Did you have a question?
I think it's more of a statement, or I guess it's a question. Like, from my perspective, like, one of the things, we have a ton of work groups already. So we're adding another work group to do this. And I understand it's an ad hoc, but it sounds like it's a pretty heavy process work group. So I'm just in my head being thoughtful about, is this, considering our desire to be streamlined in some ways, is this the right time to do that? Or is there a better way to do some of these things without creating a whole nother work group to address that need? I don't know what other people's thoughts are. That's what comes to my mind. I understand the purpose of it and I see the value in it, Matt. It just feels a lot, I think, from a process perspective.
If I may, because 100% agree. And definitely this, having the crisis management team would be a heavy lift in that moment. But I think we know from recent crises that it can be a lot to handle and process, and especially when it is just one, if it is hodgepodge, just a couple folks trying to be like, well, what if we throw together this and push this out? That can end up being more challenging and a harder lift in that moment when that crisis is occurring. So I'll emphasize that this crisis management team, as designed, isn't meeting regularly aside from that annual moment, but that would be a couple hours too. And then I think it's helpful when a crisis is actually occurring to be able to fall back on something that is already outlined. But
Could you go to your slide where you talk about the makeup of it? And I think you guys just did such an excellent job. But for me, the kicker was like, this is really the only time that we would get all of these people in the same room, like leaning on their expertise to help address a crisis. So it's not, otherwise we say maybe this becomes the responsibility of the communications work group, but then we would lack having like an HMIS administrator there to incorporate their feedback. I do think that we are going to need to review this again sooner than annual once we get done with our charter update, because there will likely be some changes to this. So I would just say, rather than you creating this amazing policy that just goes and sits on a shelf, which I think is our concern, when will you come back to tell us who makes up this group? Like, you've now done your outreach, you've determined who these people are. When will we get an update?
yeah, so if this is approved today, myself and the members of that project team would start that outreach immediately. So then hopefully we would have confirmations by the next board meeting, but certainly by the June board meeting that we could update and share. And then, of course, if we want to set up a check mark in 4 months after, or 6 months, whatever feels right, after the governance work group has wrapped up and those elements have come to a close, then we can absolutely plan for that as well.
And I can take on the responsibility too of making sure that this is added to our charter update work group for review so that we can figure out if there's any changes that need to be made to the membership.
And one other thing I did want to call out, and my apologies for forgetting about it in the moment. So when it comes to the stakeholder communication, one of the things that is outlined in this policy is around advocacy. So this would be approving, of course, within the policy, but approving for this crisis management team to make statements on public policy and do direct advocacy outreach, specifically to policies that would directly mitigate the crisis at hand.
Matt, quick question. Is this an application for these 6 members? Is that what you envisioned? Or are you tapping 6 people for these positions, or how is that working?
So originally the project team had planned to essentially reach out and ask if somebody would participate in this group,
Okay.
and then bring that membership forward to be ratified by you all as the board. But if there is a better process or a different process that you think would fit better into the broader governance conversations, that can be adapted.
Can I just,
Could that be something like, oh, I'm sorry, would you say? Would that be something like the co-chairs would appoint
It doesn't sound like it. It sounds like the communications work group already has some ideas of who they want, from what I heard.
Yes, that would be the goal. And then they would not be appointed by the communications work group. Essentially, they would be outreached, confirm if they are interested and open to this seat, and then those names brought forward to you all as the board to make that final approval.
Brian, did you have something? Because I think Emma has a question too. Oh, okay. So we'll do Tim and then Emma. Okay.
Thank you. Really just also want to compliment you. This is a fantastic framework for emergency response. Having been pulled into some emergency response centers and gone and done the national training at the facility in out there in Pennsylvania, I know this type of planning is required. But one of my questions is, if we're looking at a natural disaster or an active man terrorism threat, or something that just upsets our one of our shelters or something that has a big disruption to the whole system. When we do the tabletop, the scenario, one of the things, are we including like the Emergency Management Operations Center of the city of like Phoenix, who would likely be involved in whatever catastrophe it is as well, so that there's interaction and consistency and alignment with those, because they're very rigid reporting structures when they activate an EOC. And just want to make sure that they know that there's a group out here that they could activate to worry about the unhoused population impacted by that. Because that's often a population that gets forgotten about in these situations, is the unhoused folks. Because when you go to a victim assistance center after the CAF Act, you have to show your proof of address and other things to show that you're an eligible victim. And it's just been challenging for recovery in some communities for unhoused folks. So just throw that out there for thought. And again, just want to congratulate you on the level of work you put into this plan.
Yeah, thank you for that suggestion. And absolutely, that is something that will 100% be in that action guide as a part of kind of those step-by-step processes. But if you would like to highlight that and elevate that and bring that into the written policy itself to make sure that it is kind of holds that weight, we can do that as well. Because I think that's a great point.
So yes, I agree with the overall framework and, just the resources you've thought through. I think that's fantastic. I would also ask you guys think about realistically if there has to be a 2-week timeframe in the policy. I don't know in my previous experience that you could actually get to like 2 weeks and then get through recovery. So just something to think about if there's some flexibility that could be built in so that the committee's making some decisions about kind of real time what's happening and whether there could be some adjustments made there. Because, if I think about back in January, I don't know that we had a lot of resolution after 2 weeks and still kind of assessing the situation. And so just something to think about. And I know it is a heavy load and do think, sometimes it's also reputational damage, right? It's not just necessarily the physical or the financial, right? But it's also responding real time, right, to reputational damage being done to the various different entities involved that you might want to also consider.
Absolutely. And so that is one of the questions as a part of that checklist is there something that is a reputational crisis? Exactly. But I also wanted to highlight and open up to you all if this is a change you'd like to make. So originally the project team had discussed that 2-week time frame to really make sure that that authority that the crisis management team would hold wasn't out of step with the COC's regular governance procedures. But I open it up if you all think that there is an additional step that should be added around either extending and maybe limiting the decision-making authority that the CMT holds for that extension. I'm absolutely happy to make that adjustment as well.
I'm just gonna add one thing. First, yeah, same to Emma, to your point. I think if we were to allow an opportunity to pretty easily extend beyond 2 weeks, then it feels like that's a great way to start. I like the 2-week limitation, but would want to make it easy to extend if it comes to that. The only other thing I want to add is I can't shake this thought that we haven't, as a COC board or as a charter update work group, solidified what we want to be doing and saying around communication to funders and advocacy. Yet I see it embedded in the policy. So my suggestion would be to sit loose on that part for a while until we get it worked out at the work group level. We don't even know what we're trying to collectively advocate for and how.
Yeah, absolutely. So one thing I'd highlight is, and this isn't very well defined, so that may be a part of the issue, but there is an emphasis that any advocacy needs to be done for policies that would directly mitigate the crisis. So it couldn't just be broad overview. But one can either define that better, or two, can set that to the side and bring that back up in that 6-month check mark or whatever month check mark in the future, if that feels right for the board as well.
I just feel like we're thinking of like long-term solutions in our charter update work group and strategies. And for me, this is, if we can't access rental payment systems and we're going to have hundreds of people not getting their rent paid the next day, we're going to be doing something very different than what we're doing with our long-term strategies. And this gives them the ability to respond in a crisis like that.
Mm-hmm.
I do totally see the need for us. We're like building scaffolding around the COC while trying to create, solutions. So I think it's really important that we take all this back to the charter update work group and make sure that we've incorporated this into that design as well.
Mm-hmm. Yeah, I'm with that.
Can I make a motion?
Yes, please.
I move that we pass this. Whatever your official words are supposed to be, you can't count on me for that. but,
Motion to
yes.
approve? Is that
Yeah,
what-
that's what I
motion to
want.
approve?
Motion to
Okay.
approve.
And this is Liz, I second.
Great, thank you. Any discussion on the motion? Any discussion from the public on the motion? If we can see the members on the screen, then I think we can do a voice vote if Tish turns on her camera, if that's possible. Thank you so much. Okay, all those in favor say yay.
Yeah.
All those opposed say nay. Motion passes unanimously. Thank you very much. Thank you, Matt.
Thank you.
All right, item number 7 is clutch system modeling. MAG staff will present on 2 data requests related to the clutch system modeling, and then we'll be requesting approval from the board. So I believe we also have Margaret Adams from the City of Phoenix. And Cleo, thank you both.
Hello, my name is Margaret Adams. I'm with the Office of Homeless Solutions, and I am just going to be here to sort of frame up the work that the Office of Homeless Solutions has been doing with Bloomberg Associates. So we wanted to give everyone just a little bit of background about the work, and then this amazing opportunity that Bloomberg is bringing to the city, but also to our system. Bloomberg is an international philanthropic organization. Most of the folks that are working for the Bloomberg Associates Group are actually from the Bloomberg administration. So we have been really, really lucky to work with the amazing team on their social services practice. Linda Gibbs has been, I think we're all super fans of hers at this point, but we've even had some community members who have been part of some of the work that they're doing with us. So we're just really excited to have this pro bono, nonpartisan expertise lent to the city. Bloomberg has been working with the City of Phoenix in a number of different areas, but specifically with the Office of Homeless Solutions. I'll just talk a little bit about what we're doing. Next slide, I can do that. So some of the work, we've been working with them for just about a year now. And this is just highlights a little bit of some of the work that we've done. So they helped us with a case study that sort of reflected the work that happened around the encampment engagement around the Key campus last year. We have been talking to them about, they're helping us sort of refresh our strategic plan, our plan to address homelessness for the city of Phoenix. Some of the significant work that they're doing also is helping the Office of Homeless Solutions sort of stand up our procurement practices. How do we contract? Really helping us think about how do we measure our success and our outcomes, really helping us think about data utilization and sort of how are we better utilizing data within the Office of Homeless Solutions, but also just sort of more for the city of Phoenix and public facing. So part of the work with Bloomberg is that they have a lot of resources that they bring to the table. And so they have also done a contract with Clutch Consulting. And Clutch is a group that folks may have heard of. They have been a group of consultants that sort of started their own firm a few years ago. And I've certainly been really impressed with the work that they do. And I've had the opportunity to work with some of them in prior roles. So I wanted to just sort of talk about, before Cleo gets into sort of the actual data request, just talk a little bit about sort of what we hope to get out of this work with Clutch. So starting with like strategic alignment, this is really our goal is that Clutch is going to help us with sort of thinking about how are our resources currently aligned and how can we better align our existing resources and what resources are going to be needed. Also looking at targeted impact. So really helping us think about more high impact investments and solutions and sort of helping us avoid distractions and sort of the results of low impact investments that can really sort of impede our success. And again, this idea of benchmarking, really helping us get, really understanding sort of what are we measuring, are we achieving our goals, and then having that annual evaluation sort of as a framework and built into the modeling that they're going to help us with. So this slide just sort of talks a little bit about more of like a holistic view. So sort of how, sort of looking at the interconnectedness of sort of reorganizing the relationships that, to create a sort of more cohesive solution. So, thinking about the demand, who is becoming homeless, not only in the city of Phoenix, but in our system. How many people are experiencing chronic homelessness, long-term homelessness? Really looking at our pathways to housing. How long are people staying in the system? And then what is our current system capacity? Sort of how do we need to re-visualize investment in different project types? And then putting a cost to that. So that really is the work that Clutch is going to be helping us with. And what's so exciting for us at the city is that we're going to be looking at this again from the city of Phoenix lens, but then also we get to look at this for the whole community. So it really feels like a pretty exciting opportunity for our system overall. And again, Cleo's going to talk specifically about the data request, but this just sort of outlines the modeling platform and sort of what data sets will be used from our HMIS and HUD systems that will help us really figure out sort of how to do some of the system modeling that they're going to be helping us create. And I will say that I'm doing this on behalf of Bloomberg and Clutch. So thank them for this. And then if you want more information about Clutch or have any questions, I'm happy to answer them, but also they're here.
So then, unless there are any questions specifically for the pieces that Margaret just presented, we can move on to what you all would be voting on today in terms of data requests. Okay.
Well, real quick, I do think there's a connection. So as long as Margaret, you'll be here at the end so we can see if there's any. Okay, perfect.
Thanks, Margaret. Yeah. Okay. So there are two data requests in front of you today that were printed out and provided to you. They look very similar because they're extremely related, but basically Clutch said, hey, while we're working with the city of Phoenix, we can also do system modeling for the COC. Do you want us to do that? And we said, yes, that would be awesome if we did that. So in order to get there, there are two data requests here that relate to making it very easy for Clutch to have the data they need to do system modeling for the COC, which you have heard Natalie talk about many times with you all in terms of what it could provide to us, how it gets us to better pictures of what our system capacity looks like and what our needs are. It's something that many COCs are looking to get to, some already have, and it's this hugely useful tool that really would bring us to the next level of understanding what our system needs are. So our two data requests today are access to HDX for Clutch. This HDX is the HUD platform where COCs generally submit their federal reports, and it's where you submit your PIT data, your LSA data, your SPMs, and it's where Stella P and Stella M live. So Clutch would need access to HDX to view Stella P, to be modeling in Stella M, and then they would just have view-only access of those other pieces that they would not need for the purpose of this request specifically. And then we have another request for an ongoing data request that has been approved through the data collaborative that basically just says, if Clutch requests data under these specific categories, we're okay with just Mag and Solari reviewing it, and it doesn't have to wait for a monthly meeting through the data collaborative to slow down the process and to increase efficiency with getting the data that Clutch needs for system modeling. So let's walk through each of those. So this access would be visibility of Stella P and use of Stella M tools for the purpose of system modeling. That is what your first data request is. The ongoing data is to increase efficiency of requests that fall under these categories. They are listed here. They're also on the data request itself. The Stella P one is a little repetitive there, but essentially this is data from the HIC 2025 PIT data. This would not be them going into HDX and grabbing that data themselves. This would be them requesting that our HMIS administrator Solari would be handpicking data for them that was needed specifically for this project. The list of programs serving Maricopa County versus Phoenix, including those non-HIC projects, and screenshots from EVA, or EVA, depending on who you are, which is another type of data tool that exists in the HDX system that, again, they would not have direct access to. They would be requesting HMIS pull information, our HMIS pull information for them from that system. If there is a request that they make that falls outside of these categories, it will go through the data collaborative, and depending on the nature of the request, might make it to the board as well. But the idea behind this was to make sure that Clutch can get the information they need as quickly as possible, as long as it falls within these 5 categories. MAG will review it and Solari will review it to determine the cost and time commitment of each of those requests and the appropriateness of them. And again, if they fall outside of these boundaries, they go through our general data request process. So this is basically a request to say, can we amend our usual process for this special purpose of system modeling that we are essentially getting kind of unexpectedly and quicker than we expected as well. And someone is helping us with it, which is amazing. So let's make it as easy as possible for them while still honoring pieces of our data request. So those are each up for vote today. Brian, you might have to correct me. They are 2 separate data requests, so I believe you can vote on them separately or together, depending on how you all are feeling. So now we can open it up for questions about this.
Let's go ahead. Yeah, very exciting. I think for me, I have to think about like, why is this brought here today? And it's so informative. I need to make sure I capture and bring that forward, right? And it's because there's a data request. That's the reason why we're hearing about it today. And we would essentially be approving to no longer have these data requests brought to us at the board, which in a world where we're so busy, limits the information that comes back to us about the progress on this. So I think I would like to hear from City of Phoenix, I think, because this is like a City of Phoenix led project that then they thought, hey, let's also give you your COC data. What are the outcomes you're expecting you're going to see from the results of this? What's the product?
Yeah, thanks, Liz. That's a great question. And I mean, certainly, Rachel, you may have something to add to this, but I think part of this and the reason that we're trying to move quickly is that we really want to use this for informing our strategic plan. And one of the things that was so exciting about this was that because Bloomberg is able to provide this support, so I do think that there are some time sensitive things for the City of Phoenix that we're trying to get access to, and we can still continue to step through the Maricopa Continuum of Care system things that I don't think that there is any reason why we can't continue to bring updates and anything build-in updates throughout both the City of Phoenix process and the Continuum of Care modeling process. I don't think that it wouldn't be possible given what you're approving today. But it also allows you to move quickly.
How do we make that more concrete, right? Like, because the other thing I know is from consultant firms, like data is their most valuable resource, right? And so how do we kind of set that in stone, essentially, that if we approve this without ongoing need for further review of the data that you're going to request, we're going to get systems level information, a tool within HDX that's going to help us with this modeling we're looking for? Is there anything we can do to try to
So I think that
confirm
those
that?
are sort of like a separate, in my mind, that's a separate thing from the actual data request, because the data request is like, we may need more data to get us through this, to get us to model, like we're running into something, we need additional data. I don't think that precludes you from setting up something like programmatically that says every month we're going to provide an update, or there'll be ongoing updates, that we would provide.
And I'd add to that, I think the board would also have the ability to say in the data request that gets sent back to Clutch is we approve this request contingent upon you agreeing to send monthly updates, and that can be written in that format. And then MAG can move forward with making sure that we set those up in a recurring basis with them.
That's helpful. Thank you, Cleo. I like that. I think the other thing is they have this system mapping assumptions will be vetted by identified planning partners. Do they have those planning partners determined?
No, not yet. I think that, and for the City of Phoenix, it would be probably a different group than the COC. So I think that would be a conversation that you all would need to have about who would be part of that for the Continuum of Care.
Okay, because yeah, the other thing is now we've got this external organization coming into our state and they'd be interpreting the data, but you already have measures in place that you'll be reviewing their results prior to using it. And we would want to replicate something for the COC.
Yeah, we really view this as just an amazing opportunity for the Continuum of Care. It was already something that Bloomberg had brought to us, and we thought, well, gosh, if we're already doing it for the City of Phoenix, can't we, what do you think about adding in the Continuum of Care to your scope? And Bloomberg was more than happy to include the Continuum of Care. And I think Clutch felt like it made a lot of sense to do that as well.
Yeah, I agree too. It's just like I'm very interested in learning about what we're going to receive back from it. Like, what's the product? I want to document what the product is before we, it's good data stewardship for the people experiencing homelessness. Like, how is this going to result in some system level improvement for the experiences that they have every single day? So that's it. Just documenting it back from these large organizations so that we have something that we can, move forward with.
Yeah.
Mar-
And I think that that's built into the process.
Can I ask Margaret point of clarification? Is it fair to assume that when it's built out in Stella, we would retain the model that's built out in Stella in our HDX?
Yes, so I think they will be using Stella M and Stella P along with other data sources, but they will be producing like a model sort of external to that. So is my understanding, like they'll be creating like the scenario planning sort of external to that. So yes, I mean, those are great questions that I don't have the answer to, but we can certainly get that. But yes, everything in Stella M and Stella P you would already have.
I guess my question is, when they produce a model, we won't have to buy that from them. They'll just
no.
they'll just give that to
No.
us. Okay. I mean, just to clarify, and then so I think, Liz, to your point, like the product is we'll get a model.
Yes.
And I can kind of go into the final result, but thank you for bringing this opportunity to us too. It is definitely very exciting.
And
I think-
I
oh,
think
sorry.
they'll be facilitating also. I mean, there's going to be a lot of conversations about facilitating, like this is what the data are showing us. But I mean, I think there's going to be a lot of conversation around, where do we need to prioritize? So that is going to require, this level of engagement that you need to be a part of for sure. Yeah.
So I think that's, and those are a couple points for me that we would approve it. And I'm not going to just kind of throw this out there for now, but with the COC board would receive updates. The COC board will be a part of identifying who these planning partners are. And then the last thing for me that I want to just tee up in conversation is that we would not be receiving any notice of them looking for additional data unless the collaborative determines it's necessary. But if it is determined that additional data would be shared with them, if after the fact, we can just hear about it in our board updates. Okay. Those are the things for me, but otherwise, yeah, we totally need it. We need more resource. It'll be great to have a good mapping tool and system model in there. Thank you.
And I just want to clarify that in both of these data requests, client data is de-identified.
Correct. Yes, these will be aggregate outputs. Yes.
Yeah, and there's no client level data available in HDX or that we would be providing.
So I have a question. What are the possible unintended consequences of doing this? Because I'm always like, yeah, let's do it. And then I start thinking of all the things in my head uninformed about that could happen. So I'm sure that this is a power brain team just right up there. Like where could this go wrong? Like what should we be thinking about that we haven't thought about? Not just like a say yes, but like what are the risks?
From my perspective, I mean, I think we always have to, take everything with these are imperfect data sets, right? And so, I mean, I think we also have to have the conversations about, being, being realistic about what our system is and thinking about any potential harm. But I think the benefit outweigh any, anything that could be a negative consequence, because I think we haven't really had this level of data, that we haven't really had an opportunity to sort of look at data in this way, to sort of have these systemic conversations about investments and scenario planning. Like we just haven't really done that at least from my experience in this community. I haven't seen that we've been able to have those kinds of conversations in ways that allow us to sort of think about strategic investment and performance management and sort of how are we, how are our projects doing, and really looking at people's experience from an unsheltered situation to housing, and sort of what are the investments that we need to make that can help us get to improving our outcomes overall. So I think we have to have a realistic look at what our data are, but I would reflect that it would be worth the exercise. Not that we have to adopt any of these recommendations, but I do think it would be worth, I don't think there's any risk in exploring.
To Margaret's point, I would say most COCs pay a lot of money to have a consultant like Clutch come in and do this for them. And so the risk is less on allowing them to do the assessment and the modeling, and more on how does this board want to communicate it out. And once we get the model, what is it telling us, and how do we want to act on those things, that is where that like we're going to have a lot of thought around that and really strong communication plans and forethought around how it should be publicized or published in some way, and how it spurs action. So that is where the risk is, and we've like seen
Yes.
other communities. But like that has nothing to do with, or I would say that is step 2 of this, where we could get it and decide not to do anything with it, and it just be used as a 2025 internal reflection tool, if that's the case. But
You know, is it the type of thing where Bloomberg, is this the city of Phoenix? Like who applied for the Bloomberg dollars?
So the Bloomberg Associates is a pro bono organization, so they're working free of charge for the city of Phoenix in a number of different areas.
Okay.
One of those areas is with the Office of Homeless Solutions,
And
and
is it ongoing?
it is ongoing.
Okay.
And so Bloomberg then reached out to Clutch, because this was sort of something that we felt like the city needed in order to help guide our strategic plan and our sort of plan refresh. So that's sort of the genesis of the work with Clutch. But
Is
but
Clutch
Bloomberg,
compensated?
yes, Bloomberg is
By
paying by
Bloomberg?
Bloomberg. That's right.
And how long does that go for?
As long as it takes for us to get this done. Like we have,
Really?
yeah.
So that was my question regarding the data. Is there an end date to this data request? Is it ongoing for eternity? Is there a?
That was my question.
Yeah.
I had a similar question and actually kind of pertains to some of the requests here. So I was looking for a little more clarification. And one is, I definitely understand. I mean, I'm looking forward to the modeling. It'd be great to see that, but I wanted to have some questions on the clarifying the contractors' extended access to this. There's information here, cannot accurately predict how much time would be required for various data requests, which we understand we're giving some leeways to not make those requests, but there's no end time in any of the documentation that I've seen here for the request. And I understand it's ongoing, but I think in order to maintain some privacy aspect, I think there needs to be at least an expected timetable with expectation of extension if needed. But I didn't see that on here. And the second part was the HMIS team would like to maintain the availability to provide individual time and cost estimates per request. What are the cost estimates referring to?
so to answer your first question, the objective of the data request is to provide a system model. So once the system model is provided, that work ceases and they no longer have access to the data.
Where is that stated in here?
It's, I guess, sort of implied based on the what the request is for. So in each of our data requests, once the project is completed, that data is destroyed or they no longer have access to it. And that's sort of just how our data request process works. Usually data requests have an end date because there's an expected end time. They didn't provide one because I'm assuming we just really don't know how long this will take. And it would also be contingent upon whether or not the board approved this more efficient data request process. If requests are going through the data collaborative and or the board each month, that greatly extends the timeline for the project. So
I
the
get
timeline would change depending on what this vote is specifically.
And I understand the efficiency aspect of it, but
Yeah.
there's no it's implied, but it's not stated. And we're extending access to this. Right now, it's in perpetuity.
Gabe, if I may, if this were to move forward for approval, I think somebody should just clarify in the request for approval in the motion that it terminate as soon as the project is completed.
And that is what generally we do for data
Or
requests.
take it a step further with giving them a timeline.
And
Yeah.
that's what I'd feel more comfortable with.
Well-
Timeline, definitely understand, but I don't know what that would look like to not impede, still allow access, but to make sure that there are limitations to the access and also the third party, the secondary contractors outside of them again, this is information that we've gathered, we're working on, your team is working on. So I think it's important just to be stewards of that information.
Respectfully on the timeline, I think we thought it was going to take us 3 months, and then we thought it was going to take us 6 months. It really depends on what data you have and what you can get, and if you have to go outside of HMIS to get different data, which would engender more different types of requests. I would just say this can be very cut and dry in terms of the data they need, but it could be complicated in terms of how the model is built. So I think that if you say for the duration of the model is clearly outlined what, it's Stella P, Stella M. I think within the request or within the data request, it's pretty clear about that. And as long as you put the time or the project scope in there in the request for approval, I think you cover it.
I think my only concern with that is that the timeline for the project could be a year, could be longer. I don't know what that timeline looks like. Is there any estimate on?
Yeah, they gave us a 3-month, I mean, they said like once they got access to the data, they said that they could probably have something in a matter of months. I think they've been doing this in a number of other communities, so they have this down pretty well. But I mean, I think we could reasonably put a year on there and then revisit it if we need to, I mean, I think that there's a number of things that we could do to meet that.
And then Gabe, to your second point with the cost that gets incurred by data requests, our HMIS administrator, Solari, has a certain amount of data request capability they have built in to their current contract. And then depending on what type of partner is requesting data, it does incur various costs once it extends a certain period of time. So each of those requests has to be assessed individually based on what's being requested to know if any costs will be incurred to Clutch for the data.
So, okay, that clarifies. Thank you. Appreciate it.
I just like to add, I think you guys should be commended for being able to go out, and I'm sure Bloomberg didn't pick anybody and everybody to do this. And so this funding along with Clutch is impressive, that it's just in an attempt to improve the system.
I mean, I can't tell you how amazing it's been to work with them. It's been incredible.
Yeah. So that's awesome.
Yeah, I think it's exciting, and and thank you so much for it being at the COC board, because it should also be thought about in our governor's interagency council on housing and homelessness, and for me, this is the first time I've heard of a lot of this stuff. So it's this data request that has us at this table having this conversation, which I value tremendously, and then want to make sure that I'm capturing that as we move forward with these approvals. That's it.
Yeah.
I think that there's some things we can implement though that help us get some of that sense of security. And most importantly, we will need the report for the COC.
I also think shout out to Natalie too, because I mean, I know she's been really working on trying to figure out like how to do this for the community. And so I think too that this is just a great opportunity to sort of have this capacity in our communities.
Sure. I'm sorry, one last question.
Okay.
I'm sorry, last question. Is it the same Bloomberg group? And I think I've had this conversation with that did the city of Scottsdale exercise as well?
Yes, I think so.
Okay, so
Yes.
it's the same group. Okay.
Yes, that where they flew everyone out.
To,
Yes.
to New York,
Mhm.
did all that work?
Yes.
Okay. All right.
Yes.
Yeah. Sounds good.
Yes.
All right. So,
I mean,
so I'd be curious to see, because I mean, that was an amazing exercise. They did write a report about it. So this was done in Scottsdale as well. They picked Scottsdale a year and a half ago, maybe 2 years ago. So they were able to do this work and they gathered a small group. So I don't think, obviously, without us actively participating or being a recipient of or being selected, meaning the COC, that we'll get the same level of in-depth navigation. But I'd be curious to see what they come up with, because that was part of those groups.
I think that that's a great point. So I think we're excited about this for the city of Phoenix and sort of how can this help us develop like better strategic goals. And I think to Cleo's point, that sort of step 2 piece beyond the data is also then how are we going to figure out, how are we going to, as the COC, engage in this work. So I think that those are, important.
Matthew.
So just a quick question. I think maybe just to clarify, maybe my head is like wrapped around this, like who's going to have access to this data? Is it specifically Clutch and Bloomberg, or is it Clutch, Bloomberg, City of Phoenix, or how does that all start? Just to be.
Yeah. The request itself is just for the Clutch consultants, and then to Liz's point, bringing up the identified planning partners would have not HDX access, but access to the data that is pulled for this project. Just Clutch would have a login to our HDX system to see these tools.
But not Bloomberg.
But not.
Okay, and no other partners, so just Clutch specific.
Not the city of Phoenix.
Okay,
Nope.
yeah, I think it's, okay, great, thank you.
Nope. So there is that sort of wall of
I appreciate, yeah.
protection.
I think that was
we
the.
wouldn't be,
Yeah,
we wouldn't be looking at any of it.
okay, cool, thank you.
And a lot of the information that is on HDX are publicly available federal reports. So it's more like, it's just not traditional to give someone HDX access because that's our like internal tool, but this is an outstanding circumstance. But all the data in there is published federally. So
I just have one quick clarity one too. With the sharing of information for like COC specific projects, are we saying like all COC or are we saying like just COC funded projects?
all COC.
Okay, okay, just wanted to make sure.
Yeah, everyone who feeds into the HIC and the PID and system performance measures, it's everything. Yeah. And so to just run it back for you all, I captured that this data release is contingent upon monthly updates to the COC board. That the board is part of identifying any planning partners that become included. If there's additional data that's determined to be needed, that the board is just updated on that after it is approved, and that the request has a timeline of 1 year, at which point it would be reviewed again, should the project extend past a year.
Anyone interested in making that motion?
The only thing on that one, I do think we need to come back next month with this vetted identified planning partners. That's like a big piece of the step, like part of the work.
Why don't we start with, because I'm not sure when you'll need to start that, like given their process of like, if we approve the data request today and then they'll get access and they'll need a little bit of time. So what about if we get a timeline for like when they would recommend you, like how soon should you start identifying those planning partners? And then we can like get that to you and then
That
you
portion
can
on the May agenda?
decide like, yeah, get that on the agenda about. 'Cause
Okay.
we may not need to do that right away.
Yeah. I think I'm ready to. All right. Yeah, let's see. We'll test it. This is Liz. I'm ready to motion approving the data request with some contingencies. We receive a monthly report in May on the proposed outputs from their use of the data, including any modifications that will make to HDX around tools that we'll be able to continue to access.
Can you repeat that last part?
Including any modifications they'll make to HDX around tools we'll be able to access.
If they use Stella M, if they were to use Stella M for any of their modeling, which it sounds like they probably won't. I don't know if I understood that correctly, but if they were to add anything into Stella M, it's our property. That's all.
Okay. Okay, because it's like okay, so we'll have to scratch that off. Should I start over?
Yes, please.
Okay, this is Liz. I make a motion to approve the data request with some contingencies that they report out in May, what their project outputs will be for the COC. What are they going to help us achieve? Additionally, they'll give us a timeline on when we will identify our vetted planning partners for reviewing anything prior to public consumption. We'll add a timeline for their ability to access this data of 12 months. Lastly, any additional requests that are made within that 12 months need to be presented to the board after they're approved, after the fact. Okay.
Second.
All those in favor?
Aye.
Aye.
Any opposed? And I'm going to abstain. Motion passes. Thank you. Thanks, Margaret. Thanks, Cleo.
Thank you so much.
All right. Next item on the agenda with 23 minutes left is the legislative update from Nicole. Thank you for being here. I think you're muted, Nicole.
The magical thing that I think my kids wish would happen when I walked into a room. Can I share my screen, please?
Sure.
Let's try this. All right, so I'm going to get started. I know that you guys are tight on time, so I'm going to go through things, but stop me at any time if you've got questions. I am going to start with where we sit federally. On March 15th, Congress enacted a full year continuing appropriation and an extension act, essentially extending fiscal 24 funding levels through September of this year, September 30 of this year. There's a handful of targeted increase for housing programs, but it's just going to be a steady state until the budget negotiations are completed. Separately, I'm sure many of you know, as of April 15th, the U.S. Interagency Council on Homelessness was placed its entire staff on administrative leave, depending agency reorganization. What we're trying to do at the coalition is just come up with strategies once we know what things are true, not what could potentially be true. So what we do know to be true is right now is that we expect a level or slight increase in funding through the end of September. There may be some shortfalls. Homeless assistance grants may face a funding gap for renewals. So that is an ongoing conversation, and then we'll see what happens with usage. Recent question that I was asked are what the implications of tariffs are on affordable housing development. As of March 15th, tariffs went into place, and it is impacting construction inputs, steel, aluminum, glass, light fixtures. They're adding dollars to the per door cost. The National Association of Home Builders estimate that it's anywhere between $7,500 to $9,200, but they don't know yet. So it is looking a little tough for the cost of building. So this is going to have impact. What we'll continue to do is monitor those cost pressures and work with our federal electeds to make sure that we continue moving forward with rental assistance. There is one piece of legislation at the federal level that is up for discussion. Well, it's been proposed with very strong bipartisan support, which is strengthening the federal low-income housing tax credit and making it more flexible so that we can preserve more homes and build more homes that meet the needs of our lowest income renters. Here in Arizona, where we might need some assistance from an advocacy perspective, is David Schweikert, who was once one of the co-sponsors, has not signed on to this version. And anybody that is willing and able to do so, we have, you don't need to read this, this is really super small, but lots of talking points to share. So if anybody plans on coming to our conference next week on day 2, we're going to have all the ways to engage in advocacy across 4 pillars, both at the federal and state level, which would include the AHCIA. And those 4 pillars are homelessness prevention, emergency response, homelessness support services, and affordable housing, because they're intrinsically linked. I just want to go through a couple of things at the Arizona state level. To avoid tapping into the Housing Trust Fund this year, the legislature finally agreed to backfill the $122 million shortfall that the DDD had from the Prescription Drug Rebate Fund. I don't know if you guys tuned in, but the proposal was to sweep $38 million from the Housing Trust Fund, which had already been encumbered. But it was thwarted. The governor signed into law those dollars, I think, last week. In preliminary Senate action, lawmakers approved a bill that would prohibit encampments on college campuses. Well, undoubtedly, they were trying to focus on public safety and campus control. Some bans could displace unhoused students and may shift encampment activity off campus into other public spaces. I'm trying to think of anything else that I need to cover. Well, there was a mandate that was signed requiring the city of Scottsdale to permit Axon, which is a technology firm that does, body cams for police. And they're going to be building housing and hotel developments. I think at last count, it was about 2,000 units that they were going to be building. And so what lay ahead are budget negotiations. Most of the bills are getting wrapped up. So now everybody is pivoting to budget negotiations. So decisions made over the coming weeks on overall revenue allocations will likely impact future appropriations, be it for the Housing Trust Fund and homeless-related programs. I think I shared with one group that the JLBC, the Joint Legislative Budget Committee, put out a report last week that indicated with tariff uncertainty, with potential of funding cuts, with the potential of tax cuts, they ran a number of analyses, and one of those indicated that it's possible for us to be here in the state of Arizona to be heading into a recession with in 2027, there to be potential deficit, Arizona state budget deficit of nearly $1.8 billion, which exceeds what we have in the rainy day fund. So with all of that bleak news, I'm just going to race forward. There are a number of bills that are moving through. Some of them we've talked about, but for the sake of time, I'll jump into the ones I think matter for this group. The drug-free homeless zone, it is making its way through the Senate. We have been working to see if we could peel away support. I think where we're running into challenges is there are lots of members that think that the governor, and they're not wrong, will veto this, so they're not willing to break ranks with their caucus, which is unfortunate. But the same is true with the homeless performance audit. It was amended to be doing the right things, but this one is asking for a $1.25 million to come out of the Housing Trust Fund. We don't want any monies taken away from the Housing Trust Fund that doesn't help people. The other one marching its way through, and again, I think we'll have the governor's support, but the ban on mixed hoteling. And I'm going as fast as I can because I'm trying to honor y'all's time. And I talked about the budget, but ADO renewal is still in play. We would really like a 4-year clean renewal. The current done amendments include drug-free homeless zones, include the audit, include money coming from the HTF. We would like to see it be a clean renewal. There's a meeting scheduled tomorrow with Representative Dunn to talk through some of those things. I've been very pleased with him. He has, in fact, convened stakeholders to have an honest discussion about the best path forward. And then there's the LIHTC renewal and expansion. And given some of the budget issues that I just went through, we're trying to make sure that we have good talking points to make sure that they feel comfortable, because LIHTC does not have an immediate impact on the budget. It's pushed out. Had a stakeholder meeting this morning, and we're moving people forward. So finally, it's like we're ready to start mobilizing membership to call lawmakers to the extent that they're willing in terms of LIHTC renewal, the expansion, the clean renewal, actually. So none of the other language, but what we're trying to gauge is when the right time is. And what we're already doing, notwithstanding the fact that we have not come close to getting sine die this session, we're already thinking about next session. So at the conference next week, we are going to be launching an activity near the end of the conference to create 4 cohorts that will identify policy areas that we can run in next session. So with that, I will stop talking and see if anybody has any questions.
Thanks, Nicole. That was a lot. Anyone have any questions for Nicole on the federal or local legislative items?
Hey, Nicole, are you talking about LIHTC dollars being increased possibly?
There is an increase proposed in the federal bill. And then the bill we're trying to get run here, we're trying to increase it from a $4 million cap to ideally a $10 million cap, which is what our neighbors in Colorado have. So those are being worked on, but those are not certainly confirmed at this point.
Thank you.
Mhm.
Thank you. Any other questions or discussion? Thanks, Nicole. And I skipped item number 8, the strategic plan work group and charter work group updates. Liz DeCosta is going to provide us with some updates today. Thanks.
Yes,
And this is a standing item too. We'll have it on our agenda every month, I believe.
Excellent. Thank you. Just wanted to give a little history real quick for folks too. So it was back in June of 24 that we determined we were having a hard time executing on our strategic planning as a continuum of care. And so we created a ad hoc strategic planning work group. We received assistance from a consultant too, to really look at as a system, do interviews with where exactly we should be going as a COC. It was determined that we wanted to be a big continuum of care. We did not want to just secure our HUD funding, but we wanted to really explore how we all can come together as leaders to really systematically address homelessness within our county. And so we decided that we would move forward with 3 recommendations. We brought those recommendations to you all in January of 2025, and they were approved. The first was to update our charter and really have our charter be the structure behind how we put the language in what our goal and mission is as a big COC. So that work has been taking place. We meet every single Wednesday, a really fantastic group of folks, some of our chairs on our collaborative, some of our board members, pulling apart our entire charter, looking at all the public comment and feedback, and then really trying to incorporate that into that infrastructure like I mentioned. The next thing we decided we needed to do was also update and create MOUs with our staffing entities. And so that work is also in place right now. We were able to use the same consultant to help drive this work forward. It costs us about $25,000 in planning grant funds to do the charter update work group work, and then also the creation of these MOUs with these staffing entities. So that's all taking place. The last recommendation was that we would support a competitive process for our staffing entities, really look at how we are looking at innovation with these organizations, accountability, leadership within these organizations, and then determining that we're going to move forward with that competitive process where we do a request for information to see if there's any other organizations out there across the country or within our own staffing entities who can support the work that we design in our charter and our MOUs. And so from that RFI, we would look at our opportunities for then doing a request for proposal to look at contracting with whoever responds to that request for proposal. So those are the 3 recommendations. That's a little bit of the update for you all. We have secured the funds too to be able to cover the cost of the development of that RFI and RFP, and we'll continue to provide monthly updates as Rachel mentioned, but can answer any questions if folks have them.
Thank you, Liz. Any questions for Liz? All right. Brian, we have 10 minutes left. What are your recommendations on item number 10? Because that's a big one and also sort of related to the, yes, go ahead.
Well, thank you. This has been a jam-packed meeting. So much comment. It's great. Yeah, we're going to take one of the things off the agenda that we were hoping to talk about, but I'm going to give a quick update on it. So that item was to talk about funding. So MAG has been thinking through ways that we can deliver on one of the things that this board has requested, which is to think of possibilities, options for fundraising, all the while making sure that we're not competing in this space with other providers or stepping on toes or anything like that. So how do we do that carefully and correctly? Amy, the director of human services here at MAG, has been thinking about a survey that we would love to deliver to you all at our next meeting, or run it by you at least. And then in the meantime, I'm going to get this right. Sorry. Sorry, I had a moment like Matt did a minute ago. So we'll be doing the survey, and then in the meantime, we are going to try to present the results on the vetting process that we come up with at the next meeting as well. So kind of 2 aspects of that, more to come essentially. And then 2 other quick updates. One is that we're working on a web page. We would like people to be involved in that, preferably 2 or 3, who could kind of work on the design. This would be a COC webpage, separate and apart from the MAG webpage. And we would put things on there about the COC, news, announcements, recordings of these meetings and so forth. Some of those things would remain on the MAG webpage, just for clarity and because people are used to seeing them there. But at any rate, we are designing that, and the goal is to be able to roll that out within about a month. And so if you have interest in being involved in that process, please send us an email. Amy and myself will be guiding that work. And then lastly, wanted to cover, Cleo has been working on the homelessness trends report. As you'll remember, gave a presentation on that at the last meeting. So we have a forum coming up on the 30th of this month. She will be sending an email out with additional details after this meeting. But we'd appreciate anybody who has feedback on that future work to participate. Or if you have other just comments or thoughts on what you'd like to see in a homelessness trends report that's going to come out probably on a different cadence than you're used to. It's been quarterly. We're likely to move that to, we're talking about a monthly with a biannual, like bigger report out. I think that's all I had to cover. Thanks, Rachel.
Awesome. Thank you. We look forward to having Amy come next time. Sorry, Amy, that we're a little verbose today. Okay. I'm going to maybe skip requests for future agenda items because we have a bunch of follow-up items that we're going to have next month, plus the pit count stuff. So maybe we'll leave that there and go to board roundtable. I think we've got a couple of roundtable items.
I would like to let you all know that this will be my last board meeting. This work has been critically important to me. I'm changing employment, and I will be hopefully submitting a request for your consideration at the next board meeting to let me continue through this cycle. I think it ends in September. So, but I just wanted to let everybody know that. You can talk to me later. Take me to lunch, whatever.
Thank you, Cricket. We'll do on both accounts.
I've also got one. CAS operates the Norton and Ramsey Social Justice and Empowerment Center out in the city of Glendale. Basically, due to the end of COVID era funds that kept that thing going for the years that we've had it, we are having to phase out the services that we provide there. The services that we provide there are very Glendale specific for the most part. We operate a 24/7 hotline for the city of Glendale. We have rapid rehousing and case management services. We keep the facility open for people who are coming to get showers and do laundry, things like that. We also have a couple of partners who operate out of there, Circle the City and Phoenix Rescue Mission, do some work with their programs there. So CAS will cease offering services as of May 2nd. We're allowed our partners, we're having them stay through June 30. So it's kind of sad, because it's done a lot of really good work. The people who've been working in that facility for the last 5 years have done a lot of really good work. And Richard Southey, who's doing a lot of data analytics for the Continuum of Care, also did a project researching the impact, and 77 pages summed up as it has really done a lot of good things for a lot of people who need it. So it's unfortunate that it has to go away, but we will bring it back in some different kind of capacity. So we own the building. We want that building to continue to serve homeless and low-income residents in the West Valley, not necessarily Glendale specifically. And we're looking at what can we do that can be a benefit to CAS in some way. So in other words, that we don't have to just continue to pay for this thing by ourselves, but that we can, again, benefit low-income residents. So if you know anyone who's interested in doing something like that, like if anybody wants to do, I'll just throw this out shamelessly, like a health clinic for low-income residents, taking all conversations or anything for that matter. So it's going away in its current iteration. What we don't see it is going away permanently. We really want that thing to serve people in need in the West Valley.
Thank you, Nate. Brian?
Sorry, quick correction. We will be sending you all a survey related to funding requests, and then the vetting process on how to select folks that we would reach out to with requests for funding. We'll talk about that at the next meeting.
Got it. Thank you.
I know we're strapped for time, but that's where I think our conversation around kind of holding off a little bit on that. I know we're like, but you got to say it. So, because we are in this middle of this charter update work group, and I see that the funding survey was built on our strategies we have today. And I would just hate for us to get all this really rich information that ends up being totally transformed, you know, or not, we're not able to use it based off of what happens in charter update. So can I just ask that we actually just hold off on that for a little bit? I'm not sure what the other charter update work group folks think about it, but I would like to see this survey go out after our charter update work group is complete, when we have new strategies in place. Okay.
Yeah, I think we'll defer with you to you all. If any of you are open to discussing it in the meantime, I'd like to understand just a little bit more about how the charter would affect that, just so we're not. I want to make sure we're thinking strategically in the meantime.
Yeah.
Yeah.
So we'll give you a call.
And I do want to talk about that a little bit, because I think we can make the survey generic enough so that it's not tied to the charter necessarily, but just to larger system. But maybe we can talk about it in the strategic planning work group next Monday.
Okay, that's perfect. Yeah,
Okay.
so we can take on reviewing the survey,
Yes.
making edits, and then putting it in a place where it could still go out sooner than later.
Okay, perfect.
Yeah.
Thank you. Okay. Any other board member roundtable updates? All right, then I guess maybe we're adjourned at 3:28. We will see everyone May 19th back with the virtual or in-person option, right, Brian? Okay. Thanks everyone who was able to be here today. Thank you, Tim, and Tim